When a person has just been told they have cancer, there are so many things running through their mind. One thing they, or their parents if they are a teen, may not have thought about is how cancer treatment might change their fertility. Fertility is the ability to have children in the future. You need special cells to make a pregnancy. In females, these are eggs, also called oocytes. In males, these are sperm. For a pregnancy to happen, an egg and sperm must come together in a process called fertilization. Certain cancer treatments, like chemotherapy, radiation, and surgery, might change someone's ability to have a child in the future. Some types of chemotherapy, radiation, and surgery can harm the eggs and sperm. For example, girls are born with all of the eggs they are ever going to have. Even though they grow and release an egg each month, they cannot make more eggs once the eggs are gone. A young woman starts out her cancer treatment with tens of thousands of eggs in her ovaries. But the cancer treatment could lower her supply of eggs so much that she goes into early menopause and may not have many eggs left. If this happens, she may not have periods. She may also have trouble getting pregnant and having a baby. The same could happen to a male patient. After some types of chemotherapy, radiation, or surgery, he may not be able to make many sperm, or the sperm may not be healthy. This could make it harder to father a pregnancy. Oncofertility is treatment to save some of a patient's eggs or sperm for the future in case their fertility is changed by their cancer treatment. So when a patient, their family, or their cancer team sees the need for an oncofertility consultation, our patient navigator links the patient to the fertility experts and many other people who may help. This could include nurses, financial counselors, therapists, and more. The first step of the oncofertility visit is to understand the risks the patient might have. A fertility doctor will look at the patient's age, sex, and what cancer treatment they will get. This will help the doctor decide if the risk of infertility is low, medium, or high. Then the fertility doctor will talk about what choices are best for their fertility preservation. For girls or women, this may include freezing eggs or freezing embryos, fertilized eggs. Or it could be a special surgery to take out and freeze ovary tissue before their cancer treatment. If other choices are not available, some teens or adult women may benefit from a shot every month to shut down their ovaries and stop their period during cancer treatment. This is also known as ovarian suppression. In some cases, the shot can help keep the ovaries asleep during chemotherapy, possibly to protect the eggs from harm. For boys or men, fertility preservation includes freezing sperm. This is also known as sperm cryopreservation. It is most often done by making a semen sample through self-masturbation. Some boys or men will need surgery to try to find sperm inside the testicles. Many people wonder which fertility preservation choice is right for me. This depends on many things, such as if the patient is male or female, how much time they have before treatment, their age, if they have gone through puberty, and what cancer treatments they will have. People often also wonder how long it will take to have fertility preservation procedures. For some choices, this can be done in a couple of days. For other choices, like egg freezing, it can take 2 to 3 weeks. This includes helping the eggs develop and mature, and having an office procedure to remove the eggs. The fertility doctor, navigator, and cancer team will work together with each patient to decide which choices are best and safe. Many people also wonder how much these different procedures cost. The cost can range from several $100s to several $1,000s. The cost is based on the patient's situation and treatment. It is important to know that the patient navigator and financial counselors will help patients apply for any financial help that is available. The patient navigator may also be able to give patients information about charity funding to help cover costs. If you have any questions or would like more information, please visit the Teen and Young Adult Oncology website at dukecancer.org/TYAO or the Duke Fertility Center website at dukefertilitycenter.org. The patient navigator can be reached at 919-316-9935. Please don't hesitate to call us. We know that this can be an overwhelming time for patients and their loved ones. The Duke Onco-Fertility program would be honored to help during this journey.